A very warm good afternoon and welcome to the 11th Annual Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2018. I am Dr. Professor Sunil Deshpande. I welcome you on behalf of Pharma Leaders to this grand 11th Annual Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2018. It's a great privilege and an honor for me to stand over here and welcome you to this summit. There are two roles which I'm going to play this afternoon. The first one is my own thoughts with respect to Brand India, and second, I'm going to moderate throughout the afternoon up to the evening session. Ladies and gentlemen, the theme for this year is Brand India, Patient Care through Healthcare Innovations. Let me first compliment Mr. Satya as well as his team for a very apt theme that what he has selected this year. It's a theme which is very relevant in today's healthcare scenario in India, which comprises of various segments. The pharmaceutical industry represents one of the biggest. It's a theme which is very contemporary. It's a theme with many long-term connotations. When I was thinking about this theme, there were two thoughts which came to my mind. The first one is the healthcare innovations, and the second one, more importantly, the application of these healthcare innovations, especially in our country, in the backdrop of the healthcare scenario of our country. When it comes to healthcare innovations, the medical futurist pinpoints a few of them, like some of them I would like to mention. One is the genetics, the impact of the genetics or the genome sequencing, the drones, the blockchain technology, the big data, augmented reality, 3D printing, virtual reality, artificial intelligence, the robots, Internet of Things, the nanotechnology, as well as the healthcare trackers, variables, and sensors. Fair enough. Thanks to the digital media and, of course, the technology arising out of the digital component. But the second thought, which I just mentioned, came to me with respect to the applicability, especially in the healthcare scenario of our country. When I was just studying a few aspects about the healthcare scenario, I could gather my thoughts and summarize it in the form of challenges. The scenario is not that bright when it comes to operationalizing it, when it comes to applying it, and most importantly, the effect on the common citizen of this country is something which is at the top of the mind. The first challenge which I felt is in terms of investments, especially in the primary care in our country. The scenario, if we just move out of the periphery of an urban metro, say around 100 kilometers away from this metro, you are totally into a different world. I undertook a research few months back, myself as well as my team. We undertook a research to find out what is the healthcare scenario in a peripheral town which is around 100 kilometers out of Mumbai, which is an international hub of healthcare. And we landed up into an absolutely different world with respect to healthcare. This research was conducted by myself. It was presented in an international conference on healthcare few months back, and it is also published in one of the prominent journals in healthcare. Ladies and gentlemen, this village was around 8,000 population. It was 8 kilometers away from the main town of Igatpuri. And with this population, what we could see was really not surprising, but it was ghastly. There was not a single private practitioner in this village. There was a primary healthcare center, maybe something very similar to non-existent, and the physician attending to this primary healthcare center attended this healthcare center very randomly, maybe not even once in a week. Of course, when there is no physician around, there are no other medical facilities to mention. Of course, no diagnostics lab, as well as not a single medical store around. So how do the villagers really survive? A population of 8,000, and they also face the same kind of diseases, they also face the same kind of disorders, but that's the reality. What we could learn, what we could understand is, if a lady who wants to deliver basically doesn't have any means to be carried in an ambulance, because there is no ambulance facility. Basically, it's a man-made kind of a stretcher made out of clothes around, and simply for around 7 to 8 kilometers, the villagers have to walk around either with the geriatric person or with this pregnant lady for the delivery, and then come to the main road to catch up some vehicle which will take them to another 10 kilometers to attend to this patient. That's the status of healthcare just around 100 kilometers within the radius of an international healthcare hub like Mumbai. And you can imagine what could be the status of the other villagers in this. So we actually did some physical examination, and we also tried to go into details, and we found out that many of them were not really aware about what kind of disorders they were really facing. It was an eye-opener for them. So, ladies and gentlemen, I felt that the first challenge which needs to be overcome when we talk of healthcare innovations leading to good patient care is that of investments at the primary healthcare level in our country. But the question is, who is going to initiate that? Whether it's going to be the government, which doesn't have the funds, or whether it's going to be the private sector. But you know what's the limitations of the private sector. The second challenge which I felt was improvements in health infrastructure. When we see the rural-urban divide, 69% of our population is still in the rural, and that's the real India. We have 31% in the urban. So health infrastructure makes a big relevance, especially with respect to the rural geography of this country. The third challenge which I felt was penetration of health insurance. As per the latest figures, 2017 released by the government, we have approximately around 30% of the population which is covered by health insurance. So we have a majority of the population, which is around 70% of the country, still nowhere closer to having any kind of insurance policies, and those which are already covered, we have 80% of them basically covered by government insurance. So the private insurance has really a long way to go as far as health insurance is concerned. Child mortality, especially under 1 and under 5, the figures which are released by Institute for Health Metrics and Evaluation at the University of Washington, still we have around 78 deaths per 1,000 live births in India under the age of 5. And IHD, that is the ischemic heart disease as well as the chronic obstructive pulmonary disease, the COPD as well as stroke, they remain the main causes for the last decade. There is no change in that. The figures which were there in 2007 as well as in 2017 have the main components with respect to these three reasons as the same. The next challenge which I felt was controlling the risk factors which are driving death and disability. Now that's very interesting. The top 5 risk factors are basically behavior oriented, and they are malnutrition, they are the dietary risks as well as tobacco, and that's something which is behavior oriented, and one out of that is environmental, the air pollution, and one out of that is metabolic. So out of the 5 top factors, only one of them is basically a metabolic factor, which is because of hypertension. The next challenge which I felt is improving the personal access to healthcare as well as quality of healthcare, especially the non-communicable diseases. The Lancet, in one of the latest reports, which is June 2018, reports of very large gaps which are existing in the personal healthcare access as well as quality. They have made a very specific remark about India, especially there is a very big gap in locations like in Assam as well as in Kerala. There is a big gap. So accessibility and affordability of the healthcare, they actually go hand in hand. The next challenge which I felt is the leading causes of death. What's actually really causing death as well as disability in India? COPD and TB still are amongst the top. And amongst the top 5, again there is no change. We still have the neonatal disorders, the ischemic heart disease, diarrheal disorders, as well as lower respiratory tract infections. Now imagine diarrheal disorders is something which is still one of the most, or I would say leading, causes of death and disability in our country in the current scenario. Ladies and gentlemen, we require investments in social care. And yes, that's one area which actually requires a lot of attention again of the private sector, because yes, the government doesn't have much money beyond 1.5% of the GDP. So there is a lot of work which is required in this area. One important challenge which the country is facing is that of the quacks. And as per the IMA, we have approximately around 10 lakhs, which is 1 million quacks in the country operative as of now. As we move on from an urban area towards the rural backdrop, maybe somebody who was working as an assistant to a doctor in a primary health care center after retirement, that's one of the easiest, I would say, business actually to really get involved into. Another very important challenge which I could actually see was the errors in the prescriptions of the physicians. And what could these be? And there are various reasons for these errors. Right from choosing a medicine, prescription writing, formulation used, dispensing of medication, administration of the medicine, as well as monitoring therapies. According to a latest report, out of 1,000 prescriptions which are written, they have actually found this in a tertiary level hospital, in a service dispensary. 650 prescriptions had errors out of 1,000 prescriptions being generated. Now you can really, when you extrapolate this, you can imagine the disabilities or the inconveniences or maybe the disruptions on the negative side which are actually affecting healthcare because of the prescription errors. So, ladies and gentlemen, when it comes to patient care, I felt addressing these challenges is something which must be paramount, whether it's the government or whether it's the private sector. The issues must be addressed. Of course, it's a long way to go, considering the various pros and cons of a country like India. There are various other factors also which are prevailing. But yes, certainly the patients would be the ultimate beneficiaries of the healthcare innovations which are happening, and for the healthcare innovations actually to show their effect. Ladies and gentlemen, Pharma Leaders 2018 annual edition attempts to bring a structural, systemic and transformative change in the healthcare ecosystems and fixing the loopholes by continuously engaging the various stakeholders of the healthcare fraternity. Aptly titled as Brand India, Patient Care Through Healthcare Innovations as the theme for this historic 11th Annual Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2018, Pharma Leaders, the healthcare research media wing of Network 7 Media Group, is widely recognized and rated by the experts and industry pundits as a credible platform to raise issues of tremendous significance confronted by the healthcare industry. Pharma Leaders' much awaited and prestigious healthcare summit and roundtables brings together the most powerful and influential healthcare leaders of India in one single platform, including pharma companies, CEOs, owners, managing directors, hospital owners, healthcare technologists, social healthcare foundations, senior management from healthcare enterprises, eminent doctors, development financing institutions, institutional investors, as well as academia, to fundamentally address and impact poor healthcare outcomes and find a blueprint for tomorrow's healthcare. Ladies and gentlemen, over the next 5 years, we are going to have debates, panel discussions of tremendous significance to be deliberated by our esteemed speakers. Before we start our maiden welcome address, we present to you the theme of Pharma Leaders 2018. Can we have the AV, please?
हम एक बहुत महत्वपूर्ण योजना देशवासियों के लिए लागू करने जा रहे हैं। आयुष्मान भारत, इस आयुष्मान भारत के तहत इंश्योरेंस कंपनी के साथ मिलकर के बीमा योजना की व्यवस्था करके गरीब से गरीब परिवार भी अगर उसके यहां कोई बीमार हो जाए तो एक व्यक्ति बीमार नहीं होता, पूरा परिवार बीमार हो जाता है, आर्थिक स्थिति तबाह हो जाती है, परिवार के सारे सपने, सारी योजनाएं तितर बितर हो जाती हैं। क्या मेरे देश के नागरिकों का ये हाल होगा? 50 करोड़ नागरिक अगर उनके परिवार में कोई बीमारी आई तो आयुष्मान भारत योजना के तहत 5 लाख रुपए तक का अस्पताल का खर्चा भारत सरकार और इंश्योरेंस कंपनी मिलकर के देगी।
We're giving Americans the ability to join together to purchase much better and more affordable health care and health insurance, including bidding across state lines. So all of the insurance companies are going wild. They want to get it. You're going to have great health care at a much lower price. It will cost the United States nothing. Nothing. Think of that. It will cost us nothing.
The central priority for India has to be the creation of jobs. We speak about GDP growth, but we do not speak about how many jobs are being created. Is developing a strategy for healthcare where India can take care of its healthcare needs, and become a global hub for healthcare.
This is a jumla. This is a jumla. The point is, the scheme has been so designed that unless there is a hospital which has that treatment within 30, 40, 50 kilometers, how is anyone going to go to the hospital? He is simply going to stay in his village and suffer.
Where with the pharmaceutical companies are going to get money? We need consolidation, we need globalization. We are in a globalized world, we are in a different world. We need to explore the newer horizons on the market. So 100% of FDI should have been done without any constraint.
Hello and welcome. Enter the Pharma Leaders world of research and welcome to the iconic and historic 11th Annual Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2018. And yes, we are discussing Brand India. Known for championing the cause for healthcare innovations and raising serious discussions to pave way for a better healthcare by bringing together the finest brains of the healthcare industry under one roof, Pharma Leaders today is India's most credible and prestigious title and a senior leader in healthcare communications. Backed by more than decades of experience while working with the stalwarts of the industry, Pharma Leaders has always preferred uniqueness of the subject that appeal to the nation and are first of its kind in contents due to our in-depth expertise, research and Pharma Leaders' reputation over the years. Ladies and gentlemen, Pharma Leaders believes that healthcare access includes affordability, availability as well as quality. It means that people, irrespective of their economic status or geographical location in the country, are able to easily afford healthcare services that are effective. If access was no longer the primary issue, then 50.6 million people in India would not have been pushed below the poverty line due to out-of-pocket spending on healthcare between 2004 and 2014. But India remains among the lowest spenders on health. Our spending on public health is just around 1.3% of our GDP, much below the global average of 6%. Even the WHO recommends public health spending of at least 5% of GDP. And Pharma Leaders believes that India's public health system is in shambles and the private services, while being unaffordable, are riddled with profiteering malpractices from overcharging to unnecessary procedures imposed upon people to general apathy that has cost lives. Healthcare worldwide has been a big concern and presently undergoing a massive transformation. India too has launched series of reforms. Pharma Leaders believes that healthcare in India is in a shamble, and that is perhaps the first scheme that seeks unified involvement of the government, policy makers, private players and stakeholders. Now that India's biggest health insurance cover, the Ayushman Bharat National Health Protection Mission (ABNHPM) has been rolled out, promising quality care to 40% of poorer Indians, focus must shift to its effective and sustainable implementation. However, with inadequate health infrastructure, can Ayushman Bharat really work? Is a big question mark. Ladies and gentlemen, we need more qualified doctors. Leave aside specialists to serve at public hospitals. Going by the government rules, there is just one doctor for every 11,082 people according to the Medical Council of India and Directorate General of Health Services. We spend about 1.30% of our GDP on health, which is below what low-income countries spend on healthcare. Healthcare has become one of India's largest sectors, both in terms of revenue and employment. The healthcare sector in India is predicted to have a compound annual growth rate of 22.9% by 2020 and is valued at $280 billion. Against the above backgrounder, Pharma Leaders, nation's pioneer media in healthcare communications with close to 2 decades of understanding the healthcare landscape in India, is organizing the most awaited and iconic 11th Annual Pharma Leaders Summit and Awards 2018 under the theme Brand India, Patient Care through Healthcare Innovations. Let's take a brief overview of the present scenario. According to World Health Statistics, India has 0.9 beds per 1,000 population, far below the global average of 2.9 beds. China, for comparison, has 3 beds per 1,000 and Sri Lanka 3.1 beds. It is estimated that over 600 million people living in rural areas have no access to health care. This is primarily due to the unwillingness of doctors from cities to practice in rural areas. Even in non-rural areas, there is only one government doctor for every 10,189 people, one government hospital bed for every 2,046 people, and one state-run hospital for every 90,343 people. There have been many cases where ward boys and compounders have doubled up for doctors in performing surgeries. Pharma Leaders doubts that, given these goals, the budget of 12 billion rupees per year for this flagship program seems to be meager. It is not clear how the government proposes covering the total healthcare costs, which according to some estimates would be around 110 billion rupees. Perhaps the government is banking on public-private partnerships to make this program a success. Indeed, it's hard to imagine India successfully setting up 150,000 new health centers without strong public-private partnerships. India's public health system is already overburdened and plagued by a shortage of facilities and doctors. Most of the government hospitals cater to tens and thousands of poor patients, and because of lack of proper facilities, these hospitals often either turn away patients or force them to sleep on the floor of the hospital due to lack of beds. It is for this reason that over 55% of households prefer private hospitals for primary care, leading to a huge financial burden on the families. Ladies and gentlemen, Pharma Leaders is of the opinion that there is no clarity whether private hospitals will abandon their commercial business model to please the government and support its new healthcare plan. Many private hospitals have already raised concerns over the defined package rates envisaged for surgical procedures, as they are far below the market rates. The scheme will provide coverage of up to 5 lakh rupees per family for secondary and tertiary care. This cost will be shared according to a 60-40 formula between the central government and states. The government also plans to collect 110 billion rupees through a 1% cess. If despite these challenges, the government succeeds in effectively implementing its scheme, the Health Protection Mission will be a game changer in Indian healthcare. Healthcare is a fundamental right, but it is not fundamentally right in India. Speaking on the healthcare, Satya Brahma, Chairman and Editor-in-Chief of Pharma Leaders, opines that Supreme Court has held healthcare to be a fundamental right under Article 21 of the Constitution. However, historical public spending of just over 1% of GDP on healthcare has ensured that the country's healthcare need has remained undeserved and left for the private sector to service. The fundamental aspect of healthcare, primary healthcare, is in shambles. There is only one primary healthcare center, often manned by one doctor, for more than 51,000 people in the country. The World Bank estimates that 90% of all health needs can be met at the primary healthcare level. India has grossly underinvested in the area that should matter the most. The doctor-patient ratio in India is less than the WHO prescribed limit of 1:1,000. There is a dearth of medical schools and clinicians. Most hospitals in India are overburdened, understaffed and ill-equipped. Backed by strong research, Pharma Leaders finds out that more Indians died due to poor quality of healthcare rather than due to access to healthcare. It estimates that more than 2.4 million people died in India in 2016 due to conditions that could have been treated by healthcare, the highest number of amenable deaths among the countries studied. Of this, nearly 1.6 million people, 66%, died of poor quality of the healthcare services received, while 8,38,000 people died due to non-utilization of healthcare services. Pharma Leaders, India's first opinion-based and research-driven new age digital media powerhouse, and has a decade of memorable and glorious years of its relentless reporting in pharma and healthcare journalism in an unbiased, fearless and independent way. We stand committed to empower you, passionate about creating a holistic approach and showing the right path to the policy makers.
I think that was quite revealing and great insights into actually the healthcare being faced in the real India. Thank you so much, Mr. Satya. I request Mr. Satya to please come forward for his welcome address.
Time has come for us now to raise the standard of discussion, not to limit it to a level where you do only the sloganeering. Why to discuss about Pakistan? Why to discuss about something else which doesn't make sense? Doesn't make sense. As a media person running a media company, I feel ashamed myself that in the prime time, 9 time, I have to speak about Pakistan issues. I have to speak about what Manish Shankar has told and what that person has told, what Rahul Gandhi has told. Why can't we speak about something on healthcare and show the cases that this is what is happening? 74.9% of Indian population still reside in rural India and they don't have access to basic healthcare. Basic healthcare.
What happens when your fundamental rights of healthcare are denied? What happens when politicians make empty promises? What happens when your entire savings are given to meet with your immediate medical needs? Ironically, in India, there is one government allopathic doctor for every 10,189 people, one government hospital bed for every 2,046 people, and one state-run hospital for every 90,343 people. You don't need an epidemic, however predictable, for the public health system to collapse. It is a matter of routine that patients share beds and doctors are overworked. Satya Brahma, the visionary chairman of Pharma Leaders Group, feels that most of the ambitious healthcare reforms carried out by the successive governments has not reached out to the billion-plus people and needs a thorough introspection. India has a little over 1 million modern medicine allopathy doctors to treat its population of 1.3 billion people. Of these, only around 10% work in the public health sector, shows data from the National Health Profile 2017. The shortage of health providers and infrastructure is the most acute in rural areas where catastrophic health expenses push populations the size of United Kingdom into poverty every year. And apathy, and you have bodies of the dead being mutilated by dogs in hospital morgues, people carrying home their dead children because the hospital refused them a hearse, and tragedies like the hundreds of infant deaths in Gorakhpur's Baba Raghav Das BRD Medical College every year. BRD Medical College Hospital's failure to save lives points to a systemic rot in public healthcare delivery, which is saddled with problems of mismanagement and inadequate resources, infrastructure, and human. Despite being routinely flagged, these shortages are seldom corrected. Learning from failure is rare, and course correction after mistakes is rarer. This brings us to critical questions. Can such deaths be prevented? How can India's public health system deliver quality care? Will public hospitals just end up being places where the sick go to die? Where are the doctors? India doesn't have enough hospitals, doctors, nurses, and health workers. And since health is a state subject, disparities and inequities in the quality of care and access to health varies widely, not just between states but also between urban and rural areas. In India, self-styled doctors without formal training provide up to 75% of primary care visits. Strengthening primary healthcare hasn't got the priority it needs, and the sick reach hospitals after faith healers, quacks, and other unqualified practitioners fail to cure them. With early diagnosis and timely referrals, many lives can be saved. There are 462 medical colleges that teach 56,748 doctors and 3,123 institutions that prepare 1,25,764 nurses each year, but with India's population increasing annually by 26 million, the numbers are too little. India keeps announcing new AIIMS-like institutes in states, but where is the faculty to train these doctors? Setting up a building and buying equipment is not enough. You need trained doctors to provide care. Time for introspection, debates, and corrective measures.
now request Mr. Satya Brahma to please come forward and deliver the welcome address. Mr. Satya Brahma is India's most respected and distinguished journalist and chairman, editor-in-chief of Network 7 Media Group, which is known for championing the cause of citizens' rights and free speech. Mr. Brahma has been at the forefront of United Nations peace programs. Mr. Brahma is also the author of Vision India, Truth versus Hype, and is an industry expert, one of top journalists of India. Mr. Satya holds a master's degree in political science with first-class gold medalist from the Berhampur University and a master's degree in journalism and mass communications. Ladies and gentlemen, please welcome Mr. Satya Brahma to deliver the welcome address.
Thank you, Professor Dr. Sunil Deshpande, for your kind words. In fact, I did like your opening address when you made the key challenges that healthcare industry is confronting. I couldn't agree more with you when you talked about innovations. You talked about infant mortality. You talked about malnutrition. You did also highlight the gap between the urban and the rural India. These are the real issues which India is facing. Well, welcome to this August gatherings of 11th Annual Pharmaceutical Leadership Summit and Awards 2018. When I first conceived the idea in the month of June and July, that is the time when we actually plan out this annual summit with my team. At that time, I didn't have in mind what could be the theme. The Prime Minister of India, Modi, from the ramparts of the fort, on his Independence Day address, made a stunning remark and a statement that India is going to be benefited to a healthcare insurance policy, which many people tell that it is world's largest healthcare reforms when it comes to the healthcare delivery and mechanism. Then I thought of shifting my title from the present title to Modi Care. But I realized India has still not arrived. Having said that, I wanted to make one thing very clear to you. I wanted to tell you that I'm not a pessimist. I'm an optimist. And that is the reason why I am discussing about brand India. But the real brand India in the country is going to be possible, and you can increase the level of our reputation and the kind of recognition that we have got only when we address the domestic issues. It's very fine that the Prime Minister of India can go and visit foreign countries and discuss about various issues, sign MOUs, discuss defense deals, discuss various other factors that actually come into the governance and the style of functioning in India. But has Prime Minister Modi missed the bus? Did he realize it is equally important that healthcare is the most important factor, so also the defense? We have given so much of importance to the defense. Of course, there are conflicting reports coming from Pakistan. There are issues in Afghanistan. The Balochistan is creating problems. There are separatists in Kashmir. There are problems for the citizens. Now, the Punjab is also creating a Khalistan movement. But these are not going to help anything, actually. They won't succeed. India has a robust system, actually. If you ask me personally, I will tell you, I have analyzed the entire DNA of the entire fabrics of India's mechanism. We are so much strong when it comes to our internal findings and internal strength. This is not going to break India for sure, actually. Politicians may claim from here to there, and they may talk about various other things, but it doesn't really impress me that this is going to happen, because we are very strong in that area actually. Yes, we're talking about healthcare. When we talk about healthcare, there is a tremendous development of the Indian pharma industry, diagnostic industry, then pathological services, then CROs, then so many other affiliated areas. But does anyone think about the patients? These are the real beneficiaries of the healthcare mechanism in the country. We cannot call ourselves as a superpower if you don't look at our own people who are suffering day by night. The Pradhan Mantri Ayushman Bharat Yojana, the CEO of Ayushman Bharat, in fact, will be here after some times. I have a very mixed feelings when it comes to this healthcare insurance. Is there any guarantee that 500 million of population with having wide range of problems will take the treatment at one time? Did Modi act in haste in view of the 2019 election that is going to come? We shouldn't talk about the Rafale deal, we shouldn't talk about Augusta Westland, we shouldn't talk about any other deals even. I don't belong to any political party, whether it is Congress, BJP, Aam Aadmi Party, or any other political party. But my fundamentals are very clear. Let us think India in realistic terms. What has actually gone wrong? To me, if you ask me, the thing that has not gone down well in the Indian healthcare fabric and the structure is that it is not patient-centric. Dr. Natarajan is here as one of the seasoned surgeon. He will agree with me that the rural India is the most affected ones. We can avail treatment over here, but when you go to the rural areas, actually, there are no primary doctors. There are no nurses, actually. When you go there, some of them, in fact, have opened up their pawn shop there, actually. There are no people out there. Then how can you claim that healthcare delivery and healthcare access is going to be a reality? It will never become a reality unless you look into it, actually. Please don't treat ourselves as mere the voters. Don't give us the empty promises. Don't tell us that this is going to change India. Don't tell us that this is going to create job opportunities. Please don't lecture us how we can develop the system and how we are going to vote you based on your performance. Where are the performances actually? Prime Minister Modi swept the nation actually in 2014, defeating Congress party, which actually ruined India and took back actually for around 10 to 12 years actually. We are nowhere in the scenes when it comes to the Western countries, when it comes to the European countries. Look at the number of US FDA facilities that India has got. No one in the world has got it. Why do US FDA make it very difficult for our companies that your factories and the manufacturing laboratories are not up to the standards? This is actually a politics, and this is the stepmotherly activities they are giving it. I can tell you, Dr. Dange will agree with me here actually. Our manufacturing facilities are far more better than the European countries. They cannot match with our standards. We maintain a total standards out of it, bearing few which are very negligible. But you can't raise a fingers at WOCAD, you can't raise fingers at Sun Pharma, you can't raise fingers at Cipla, you can't raise fingers at all those top pharmaceutical companies, manufacturing facilities, saying that some clean room has not maintained, this thing has gone wrong. This is a pure politics. Now the point to this reminder is about how we can address these challenges, whether it is a healthcare access or it is a healthcare affordability, is actually we have to continuously engage the various stakeholders of the nation. We have to engage with the people, we have to engage with the social reformers, we have to take their views very passionately and listen to them. You can't simply come out one fine day and tell that this is the reform we have done it actually, and this is going to change India. It will never change. India has a history of building a strong power center by thinking progressively and continuously. It doesn't happen with overnight actually. You have to prepare actually. You have actually certainly one is demonetization is gone. And to add to that pressure as GST came. But GST is a game changer. Let me admit it's a game changer, but it is actually badly planned and implementation was very wrong and a lot of SMEs got suffered actually. this has a direct impact with healthcare over here actually. Many of the pharmacies, many of the hospitals, where they were earlier taking actually money, now they are actually refusing to take money in digital format. So where is the digital India? And where is the cashless economy that you're talking about? This system is still prevalent. But I see a very bright future of Indian healthcare industry. I know that we have the finest leaders of the country who could make a difference. These are the people who would give us a new direction of how we'll go forward, taking into considerations the entire aspects. We are a global superpower, and we will make a difference in the society if we dig out the truth and if we address the real core issues. That is about going details into the patient-centric process, which is actually missing in current country scenario actually. There are no available doctors which are there in the country. This is the biggest concern for us actually. Healthcare policy and Ayushman Bharat will definitely be a game changer if the people in the hierarchy and the state and the central relations and the federal mechanism of the country work hand in hand. Chandrababu Naidu can't tell that CBI can't enter into my territory. Who is he to tell like that? CBI is doing his job, but that politics apart, this is where the problem lies in. When center proposes something, the opposition creates a difference over there. So my humble submission is that we need to build a very strong and robust mechanism, and it could really make a difference by bringing the policymakers, the pharma owners, the consultants, the bureaucrats, and the medical practitioners, and some of the finest leaders of the country, and discuss over the issues and find out a solution. Well, ladies and gentlemen, over the next 4 to 5 hours, we are going to have a brainstorming discussions, and a lot of sessions are going to touch upon these key areas. I'm privileged to have with some of the finest speakers in this session. They will be actually enlightening us what is going on in the country. With this, I conclude my welcome address, and I hope you'll have an enriching experience for the next 4 to 5 hours. Thank you very much.
Thank you so much, Mr. Satya Brahma. You have actually shown that you are not a pessimist and you are an optimist. But your talk actually talked about, featured how real India has not arrived, which is quite relevant. Has the PM really missed the bus with respect to healthcare? Because still quite a few domestic issues remain unresolved. We as a country, have we not leveraged the strengths, especially with respect to healthcare? And you have really pointed out one factor which makes the difference, and that's patient centricity. Have we lost out on having empathy for the patients, especially the various stakeholders in the healthcare? You have nicely highlighted a contrast between the strengths which are there as far as the pharma industry is concerned. At the same time, in contrast, you have reflected the current healthcare scenario in the country. So what is the missing link? And the missing link basically is engagement of all the stakeholders in healthcare and trying to sit around and trying to find out a solution to leverage the strengths and address the issues, especially the patient centricity. Thank you once again, Mr. Satya Brahma, for a wonderful insight into the healthcare scenario of our country. We move ahead now